Good morning, everybody. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit to my playlist where I have provided all the so far discussed topics in a systematic order. Anyway, my dear friends, I have been discussing about autism or autism spectrum disorders in the last class. We have taken the introduction. First part has been covered. So today we will continue the same. Now, as we know, autism is a problem where child is cut off from the world, external world. Especially there is a sensory block. All the sensation block will be there. So sensations are not able to reach the hypothalamus and rather thereafter it is not able to reach the sensory cortex, and as a result child is not able to respond for external stimulus. It may be in the form of the auditory stimulus or visual stimulus or any other stimulus. He is not able to respond for that. So we know that in the autism basically there is a problem with the two domains. One is with the social domain and another one is the language domain. In the social domain, because of the visual and as well as these other sensory and as well as auditory problems, he is not able to give the reciprocal reaction. And as far as the language is concerned, again it is related to the auditory sensation. Again there will be a problem. Now, when we diagnose autism spectrum disorders in the OPD, there are so many problems will be there. Okay, usually a child with autism, he is cut off from the external world, and there are so many behavioral issues will be there. We know that every child is different and it is very difficult to assess the behavior of every child. Okay, because why I am telling this is every child of autism will behave a different way. We cannot get a framework here or a fixed framework so that this will be autism behavior. No, it's not like that. Many times an autism behavior may also looks like ADHD behavior, autism, attention deficit hyperactivity behavior also. So this is one of the practical difficulty. So behavior of the child, when you see a autistic child may behave in a different way. But anyway, we have got three basic set of symptoms which will be seen in case of autism. One is called as core symptoms of AHD core symptom, main symptoms. Another is the behavioral manifestations of the AHD. Another one is sensory issues may be hypo or hyper responsiveness seen in autism, AHD. Okay, so we have to look into the symptoms in these three stages. One is typical symptoms of AHD, must and should symptoms of AHD, autism spectrum disorder. Another is behavioral issues or behavioral symptoms related to the autism spectrum disorders. Another one is some of the sensory. It may be hyper or sometimes it may be hypo. If you look into the core symptoms of ASD, if you look into the core symptoms, the main core symptom of autism is cut off from the external world. He is not able to give the reciprocal reactions, or he is not able to cope up with the external world. He is not get connected with the external world. He is living in his own world. Okay, so because there will be a deficit and social and communication problem. So why this child is cut off from the external world? He is living his own world because he has got problem in the social domain or social developmental milestones, communications, and also there is a problem with the sensory issues. So because of the social problem, he will have emotional reciprocity will be lost. He lost the emotional reciprocity. You will not get a reciprocal feedback from the child when you interact with him because his social developmental milestones has been delayed or lost. So you cannot get a reciprocal feedback from him. When you ask the child what is your name, definitely he will not answer you because he is not able to receive what you are telling. Or you cannot talk him with even the non-verbal communications also by symbols and all, signs and symptoms. He will not able to suggest because visual perception is also not up to the mark. Another is there is reduced responsiveness to the other people facial expression. This is what I just told. Even the non-verbal communication like facial expression, body gesture, the response of the child is again reduced. Absent or delayed response to the name being called. Usually in the OPD level, how to detect the autism? The first question is always, what is your name? Okay, just ask the name. Usually, any child who is above 2 year old, he will give the response to this question by in one or other way. It may be in the verbal form, it may be in the non-verbal form, or it may be in the emotional form. So he will give some response. But a child with this particular autism problem, so he is not at all receiving your signals, so there is no reciprocal reactions. Another is there is reduced and absent responsive social smiling. These are all the problems related to the social developmental milestones. Okay, social smile is not there. Usually child respond when its name has been called during the maximum by 1 year. Previously I told 2 year, but just by 1 year, after 1 year itself, whenever you call the name of the child, usually give the response by one or the other way, but autism child will not give it. Okay. Usually we know that during the birthdays and all, first birthday of the child, so when you call the name of the child, he will come, isn't it? Everybody might have been noticed. Okay, he will give the response. So during the birthday, somebody is giving the gift and they are calling the baby, come, come, come. So usually baby will come and respond and come, but this is not the case with the autism child. Second important issue is a non-verbal communication behavior. So non-verbal means you are not talking. Language means you are only body gestures and facial expressions you are using for the communication. There is no language. So there is no speech rather. Okay. So if he is not talking, so he develops his own way of expressing his feeling and idea, and that is a repetitive behavior in a non-verbal way. Now, most commonly seen another symptom in case of autism is a repetitive behavior. Child is tapping his own body or doing some body maneuver repeatedly, or child is preferable to sit a particular place only always, preferable to prefer to do a particular work, or play with a particular play toy, etc. Okay, so as he is not able to verbally communicate with you, so he will develop his own way of expressing non-verbal pattern. Okay, so one of such non-verbal pattern is repetitive behavior. Any repetitive behavior, it looks very abnormal for the parents, but as the child is not able to communicate, he develop such a movement for expression. Okay, so definitely it looks very abnormal for the parents, because child is not talking to anybody and always he is tapping his own body, or some finger movements like that. Actually this is a type of non-verbal communication that he developed by his own, because he is not able to communicate with the external world because of the problems. He is not able to communicate verbally. Okay, the social interaction is also poor. Now anyway he has to develop one way of communication with the external world. Now he started his own way of communication, okay, by doing these repetitive movements. But for a clinician and for the parents, it looks very abnormal. So this is called as repetitive behavior, and this repetitive behavior is very, very common in case of autism. Example, he keep pulling the things, okay, he keep tapping, keep beating his own body parts, etc. Okay, so there is also reduced or absent social use of the eye contact. Eye contact is lost. This is third important part. So we have got the problem with the language, problem with the social developmental milestone, and the repetitive behavior is there. One more thing is, there is, because of the social developmental milestone has been delayed or absent, so this leads to the poor eye contact. Child is not giving any eye contact with you. He's not talking with the eye to eye. Okay, so he, in the sense, he is not responding to you at all. Whatever he is doing by his own. So these three are basically considered as the core symptom of autism. We have got some other core symptoms of autism, so that we will discuss in the next class. Thank you very much. Please don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.